Thanks for hanging out and waiting around. I hope you're still there. So I'm here today with my friends Vanessa and Elika.
Hello.
And we're going to have a conversation about mental health awareness, all things mental health. So I'm just going to hang out for a little bit and wait. Wait for a couple more folks to join us. Hi, how y'all doing today? It's a beautiful day in New York City. I feel like it's the first bit of sunshine we've had in a while. How's everyone doing? How was your day? Anything interesting happen?
You know, I was so happy that it was sunny this morning.
Yes.
I mean, I think that the rain is like sucking the life out of me.
It feels a little bit Seattle-ish, right?
Yeah.
Like, just
Sorry, Seattle.
sorry. Anybody's there from Seattle. But the past couple of days, it's just been rainy and cold. It doesn't feel like May.
No.
Well, May is Mental Health Awareness Month, so I just wanted to use the opportunity for this live to have a conversation about mental health. Some of you all sent in questions, so we'll be answering those questions. You started your new job. Congratulations. Yay, new job. We're excited about new jobs here. Usually when I start my live, I start thinking about something interesting. The last time, what were we talking about? I know one time we were talking about movies. I'm actually thinking about going to the movies tomorrow. Any good movies you've seen lately? Or any movies at all?
I haven't seen anything lately, although, everyone's seen The Avengers. I have not seen The Avengers.
I have not seen The Avengers.
I
don't yet. I think that if I would be like jumping on the bandwagon if I went to see The Avengers. Like I wouldn't understand what's going on. I only know Iron Man. Is Spider-Man an Avenger?
I think so.
You know what I mean?
I don't know.
We're sorry.
I don't know.
We're sorry, Seattle, and we're sorry,
We
Avengers.
don't know anything about the Avengers. We are going to talk a little bit about depression tonight, Nikki, so we'll get to that. You went to the movies. Was that a while ago?
Yes, that was killing time, and I saw something very light. What was it? I forgot the
The
name.
movie with the little girl, right?
Yeah. Who grew? Yeah, she was. It was great.
We're not
It was
good movie people.
Yeah.
We need to get it together.
We're
Have y'all
sorry.
seen any good movies lately? Chime in and let us know. So, let me formally introduce my friends to you. I thought this would be fun to have this conversation with them because I feel like I have a lot of conversations with y'all about the things that we're going to talk about today. So I met her professionally. So this is Elika.
Hi.
You want to tell the people?
Sure. I guess I'm a social worker by training, and so I have a background in public administration and social work.
I'm sorry. A man just walked by. I just want to explain something to y'all. Usually I do lives at home. Not at home. There are strange people walking through the living room.
It's not a man in your house.
It's not a strange man in my house. My good friend here allowed us to use this space, and so it's a co-working space. So you might see people walking by. So don't be alarmed. Okay. Sorry. Go ahead.
Yes, so I'm a licensed clinical social worker, and I also have a background in public administration. That's my background.
Right. So I met her when I was on postdoc in Miami. So I was working as a therapist within a college counseling center, and she was an assistant director in the victims advocacy unit of the. I guess we were merged at that point, right?
Yeah, we were merging.
So I met her first professionally, and we shared a couple clients, and now we're great friends
And neighbors.
and neighbors. Friend?
So I met Keisha in the choir, and I'm trying to think of how we became friends on the beach in. No.
It was when we were doing that banquet.
Oh yeah, that's right. We were volunteering
Mhm.
on a committee to host the banquet, and anyone knows if you volunteer on a committee with me that has to do with events, man, my husband says I make people cry. I don't, though.
I don't see how you would make anybody
right?
cry.
I don't think so either.
It's
Anyone
not
that knows
you,
me right
it's
here,
them.
please don't. Exactly.
It's them.
You know, but we really hit it off because, like, we were like down to business. I was like, I like this girl. We're in it.
And then we hung out.
And then we hung out at yeah, I love your transparency, and you've been such a support to me. And anyone who knows me knows I like to say it how it is.
Yeah.
Talk about the real stuff.
I think that's why we get along so well. I think that we're able to have difficult conversations and be honest with each other. And,
oh, that was our
okay,
light.
so we had a light. That was the technical difficulties. Yeah. We were trying to have a light, to have good light, and the light just fell. But nothing's broken. Yeah. We're good. We're good. Yeah. We're just gonna carry on. We're just gonna carry on. But so, if you know, most of you know me, and so I am a psychologist by trade, and I teach psychology at the community college level here in New York City. And so we're actually on the mental disorders unit now, which gets really interesting. At this time of the year, we have really interesting conversations. And I've had a lot of them checking in with me over the past couple of weeks, like, hey, and the question is always like, so I have a friend. So I've gathered some questions earlier in the day, but if you have any questions while we're here, just feel free to pop it and I'll see it down there. Know that sometimes there's a lag between when you write your question and when I see it, but I'm going to get to it, right? So let's get to our topic. So the first thing that I wanted to ask everyone was, what was your first encounter with mental health? So I'll give you mine, because I was thinking about it on the train ride here. When I was little, I used to live with my grandmother, and on the street there was a man. And Caribbean people call people with mental illness mad. Like, that's a madman, that's a mad woman. And so you grow up hearing that term, and as a child, it's scary. It means, like, that's a madman, that's a mad woman. You stay away from them because they can hurt you. And so there was a man that lived at the end of the block. He was a relatively young man. And everybody used to call him Mad. Let's say his name was, I don't want to say his real name. Let's say his name was Bob. Everybody used to call him Mad Bob.
Sorry.
That's what everybody calls him in the neighborhood.
You're reminding me of, like, yeah.
Because I feel like a lot of people have these stories.
Mm-hmm.
And I don't know what in different communities people call people with mental illness, but in Caribbean people call them mad. So that was Mad Bob. And he would oftentimes come to the gate to get food from my grandmother, even though he lived with people. I don't know. Anyway, my grandmother always would give him food. And there was always a story about how he'd come to the U.S. when he was younger, and he'd been in the Army. I don't know what the story is. I don't know if there's any truth to the story. And so that was my first encounter. Or you would see people on the street, and they're like, oh, there was a man, when we were growing up, they used to call him 3-spin. Because he would walk, and then he would spin 3 times. And he would walk. Like, that's how he would walk down the street. And so as a child in the Caribbean, you'd be walking the streets, going home, going and coming, and you would know to stay clear of these people because they were mad. So that's my first encounter, like, I thought about with mental health.
So I'm glad you said that story, because I was like, how much? I don't remember that. But my childhood fear was crazy people.
Yeah.
Exactly some of the behaviors that they just call them mad, like they can't control. It's just something that I felt like they would go out of control, so that was my fear in some ways. So I remember traveling to New York as a kid. I was probably 10 the first time I traveled to New York. And just like the encountering, you know how different homeless people, how New York is, and how it was in the 90s.
I'm gonna go get a friend.
Okay. So
keep talking.
So basically that was kind of like my that was my kind of encounter, and kind of like the thing that I remember as a kid when it came to like mental illness. But of course, it wasn't the label for it. It was just like crazy people.
Right. We weren't given the tools to really like
to understand
it.
Yeah.
I mean, honestly, the first time I really thought about mental health, or I mean, I didn't know that that's what we called it, was when my mom was in the psychiatric ward, and I was young. I don't even really know how young I was, but I remember my dad taking me to visit her, and I remember walking down this hallway, and there were all of these what I would call crazy people. Back then, that's the word I had for it, and it was like they seemed so different than my mom, and I kept thinking to myself, like, why is my mom here? Like, why is this isn't like a regular hospital? And we got to the room, and my mom was in her bed, and she seemed like herself, and I didn't understand why she was there. And it was interesting because my dad was a minister, and it was like kind of a secret. No one talked about that she was there. It wasn't like other times when people were sick in the hospital with cancer or had a baby or broke their leg or whatever. People talked about that, right? But for some reason this was different. So my mom was in the hospital, but it was something that we didn't talk about. And it was I didn't realize that until later, but it was from that early age that I realized that I kind of started internalizing this idea that talking about issues that have to do with your brain or your feelings are something that you should keep to yourself, and if you have a problem, you kind of need to be ashamed about it.
Yeah, I'm glad you said that, because I feel like these things that we're talking about, they're general themes that transcend age, race, gender, nationality, that when someone has a mental illness, sometimes we're socialized to be afraid of them, that they're dangerous, or that we don't talk about that. We don't talk about it. So I'm curious for you guys, what were your first encounters with mental health, or was it similar to what we've been talking about? We do have one or two other people in the room. I don't know if they want to chime in. They seem to be, taking their jobs very seriously here. So yeah, that was my first encounter with mental health, and I think, so now that I look at it as an adult, right?
We're adults.
Well, okay. I was having this conversation with my students this week because they seem to think that adults aren't really adults. Yeah, so I mean, they kind of are technically adults, but so they were like, because I was asking them, like, when do you really start feeling like an adult?
Right.
And so they were like, well, I don't think you ever start feeling like an adult. I feel like all the adults are like children that are faking it.
I do kind of feel that way sometimes, especially as we talk about mental health. As you were saying, when you realized you were an adult, you had a different view on mental health.
No, but I just think that whole adult thing is interesting. Yeah. Anyway, but when I look at it, and the only reason I thought about that man, I think recently, is because his older brother died. And my brother was like, oh, Joe died. That's not his name. Joe died, and so I was like, oh, you mean Mad Bob's brother? Oh, so you're joining? So someone else is joining us. So we're going to try to get her. Yes, there she is. Yay. So this is my friend Ann. Actually, I went to college with her. So everyone just kind of sort of introduced themselves. And
that's good enough.
That's good enough. Do you want to tell us about your first encounter with mental health?
I don't know my first encounter with mental health because I felt like a lot of times we just avoid it. So I can tell you a lot of times I avoided mental health, and it probably started maybe with college, maybe finals or midterms, and your friends, your good support group helps you. Your good support group, you have a good support group who helps you graduate, pulls you through.
Yeah, I think definitely when we start getting down to finals, I think a lot of colleges and universities are intentional about providing stress-free zones when they're coming down to finals, because that's real.
In our office, that's when things were coming up. The numbers came out, because if you had trauma, a lot of stuff
stress will sort of make things worse. So sometimes things are sort of like underlying.
But I also wanted to part of avoidance is drugs. So a lot of people growing up did drugs to avoid their mental health issues or whatever problems they were having. So growing up, mental health equated to those who did drugs.
Yeah, so and now we can sort of think about that and talk about that. So one of the things that we talk about is anxiety, right? And so I always teach this unit and I ask students, like, have you ever felt nervous? It's like, yeah, everyone's felt nervous or anxious. Usually, that's just like a part of life, right? Like you get nervous. When do you get nervous in life?
Oh, before you have a big job interview?
A big job interview.
Or a date.
Or a date.
Or
she's laughing. People have dating questions. We're gonna get to
When you
those.
feel inadequate.
when you feel inadequate.
Yeah, your insecurities are sort of like rising up, and usually, if you go through a situation and then your anxiety goes away. People who suffer from anxiety is what we call free-floating anxiety. It's just kind of always there. It's ever present. They can't say, oh, this is making me nervous. This is making me anxious. It's just something that's there. And usually it could be because of a neurotransmitter imbalance, meaning that there are things going on in the brain that shouldn't be going on, or there are things that should be going on in the brain that are not going on. And that's where medication comes in, right? I'm not going to get into the chapter on the brain, but that's just like a simple explanation for it. Or sometimes we have anxiety because we have underlying issues, underlying trauma that we haven't gotten to, or that we haven't even acknowledged, or we haven't spent the time sort of like working through. And so the anxiety will pop up, or it will get exacerbated or made worse when certain circumstances in our life or situations in our life change and adjust, right? And so that's one of the things. And so I was talking about, now you're seeing a lot of, going back to what Ann was saying about the drug use, like a lot of performers will tell you that they've been struggling with anxiety lately. And so they'll also tell you that's why they engage in a lot of drug and alcohol use. There's a lot of people who suffer from social anxiety or any number of anxieties, different types of anxiety will utilize drugs. And so you might be familiar with people in your life or in your past who've utilized drugs a lot, and you don't realize that they're using that to mask their mental illness or to address the symptoms, right? So that's sort of like anxiety. Anybody want to chime in?
I was just going to say, I feel like also drugs, but also other stuff like food or some other behaviors.
Shopping.
I think a pain point back here.
I think I stepped on somebody's toe back here. Not gonna point at who. But yeah, shopping, eating. A lot of people eat or don't eat.
Yeah, and I think also there's this kind of, it kind of can manifest its way in you where you almost stop taking care of yourself. You know, I know for myself, I have struggled with anxiety since I was a very little girl, but no one ever named it, and no one ever gave me the language or the words to talk about it. So I didn't really understand that that's what I had until I became an adult. And a lot of I didn't abuse drugs, but I would stop taking care of myself because I didn't feel good about myself. I would put other people before my own care, caring for others. And it came across as this kind of thing like, well, I really care about other people, but really it was a self-loathing thing. It was a self-deprecation thing. And that's how it was manifesting itself in my own life.
Yeah, so I would say, so I think that's a really good point, Vanessa, because I think that sometimes we're under a lot of stress, or just our anxiety is just like a level above what we're usually able to manage on a daily basis. And if you find yourself falling out of your routine, that usually is sort of like maybe a yellow flag, not quite a red flag. That something might be going on with you, or even if you notice that in someone else, right? That they've fallen off of their routine. They're not eating the way that they should. They're not sleeping the way that they should. I think I wrote my blog post this week about thoughts and how thoughts can, what drives anxiety a lot of times is thoughts. And people just sort of having their thoughts dictate how they respond to different things, right? And so when your thoughts are sort of like in control, we were talking about it giving you a difficult time sleeping. Like, I know for me, that's an issue. If I have something major going on in my life and I just haven't figured it out or I haven't sorted it out, like, I will just lay awake. Like, and so taking control of it means kind of like, literally sometimes telling myself to stop it. Like, what are you doing? What are you doing? Like, stop, take a breath, focus. So if you notice those sorts of things popping up, that might be, an indication.
I think for me, a lot of my anxiety, when I figured out what was anxiety was, I was going to the doctor a lot because then it showed up like some form of panic attacks and like having symptoms of like my heart beating fast. I thought it was a heart problem. Then I went to a throat doctor because then I had acid reflux. So it looks like more like what I was eating, but it was really what I was feeding it was actually the anxiety in some ways. So the way I was able to fix that was through diet, but it's really recognizing that in some ways it was anxiety. And then the aches, the physical aches made me more anxious because now I was like, what's wrong with me? Like in that way, so.
Yeah.
I was just going to say, fun fact, that when I'm stressed out, I'm well rested. Like, I will literally go to sleep when the world is burning down. I can eat a bowl of ice cream and I'm asleep.
I mean, she used the word burning down.
Burning down.
I
mean, no, you need to be awake. She fights fires for a living, people. You need to be awake if the world is burning down. That's all. Oh, yeah, we made that up. So yeah, some people sleep a lot. Some people will sleep a lot. And you're right. Someone was saying that if it's prolonged, that medication and therapy does help. A lot of people are afraid of medication. Let's talk about
some drugs. The other kind. Sorry, I just put it out there.
Well, let's talk about medication.
have a funny Xanax story.
You have a funny Xanax story? Go.
So I had Xanax for the times I felt anxious. So I was flying to Montreal. I had to stop from Miami so I had to stop in New Jersey. When I got onto the flight, it was like a 2-seater on each side, and I was like kind of like in the first it was bad weather. I'm like, whoo, this flight is about to get bad, and I popped the Xanax. I don't know if it was the Xanax or it was the best flight I've ever been on. It was great. No anxiety, flight was easy something, but after that, because I guess the anxiety didn't come up, it was because when I got to Montreal, my aunt was taking me around. She was probably wondering what's going on. I was like high. I was high because I guess the Xanax didn't have anxiety to kill. I guess that's my thing, but it was terrible because it was just I felt drowsy. I think I was like this. My aunt
did you take the Xanax as prescribed, or did you just?
No, I think I took one, and I had a very low
dosage.
Yeah, but I was like, ooh, small plane, turbulence, Xanax, and it was.
So we need to know the difference between when we need the medication and
I would say so.
When we don't.
If you don't want to scare your family.
Yeah. But the medication, let's say she really was anxious, it would have made the flight easier, but she shouldn't have been over the top quite like that. But why are people afraid of medication?
I mean, for me, I know I'm a person of faith and I'm a Christian, and growing up in that community, there was always this underlying idea that if you needed medication, that there was something lacking in your spiritual relationship with God. And, I think that shows up in other parts outside of my faith community too, but I think in the faith community, it's a very strong because they equate this idea with worry as being the same thing as someone who struggles with anxiety or like real insomnia. And I mean, for those of you that don't know me, I've had cancer twice. I've been through a lot in my life. I was adopted. I have a lot of issues with belonging and abandonment. I was betrayed by my ex-husband. And
plug your blog right here.
And I have a blog, VanessaJoyWalker.com. It's really easy. It's just my name. You can follow me on Instagram if you want, or don't, whatever. But you know, I don't like self-promotion. She distracted me.
But she talks. You talk about this stuff. You see how she? Okay, so this is what we talk about, me and her, right? But she's like, I had cancer twice, and I had a horrible ex-husband, and I was adopted, and I got all these issues, and the church people are telling me that I need to stop worrying and I don't need medication. It's basically what she just said.
That is exactly what she said.
She writes beautifully about her experiences, and I think, and the foundation of what you always talk about is finding joy in the midst of all of that.
Yeah.
And so that's why I think it's really important that people get to hear your story, because I feel like in your story they'll see themselves.
Yeah.
And so they need to know how to find you. So it's VanessaJoyWalker.com.
Thank you. And you know, I really feel like there is this, for me, there was this idea that even when I had cancer, that if I really needed the drugs to sleep, that there was something wrong with me. And it was like my whole goal was, when can I get off the drugs? What can I do to get off the drugs? And it became this, honestly, I became anxious about getting off the drugs. I became obsessed with that idea. And as I went on, my own anxiety, the generalized anxiety that I had been struggling with my whole life, began to increase. But I was so afraid to actually get help, because even though I had come a long way as I'm an adult now, and I could look back on my mom's experiences and realize that like drugs saved my mom's life. I mean, when you're bipolar, I mean, drugs can really help you if you have great doctors. I still felt like I was failing if I went to a psychiatrist. And I felt like I had to kind of say, oh, well, you know, I'm doing this because of this. No, I'm doing this because I'm a Christian, I have a strong faith, and I struggle with generalized anxiety. And, you know, that's okay. And you know, life is complicated. And part of the reason I always say part of the reason I talk about joy so much is because sometimes I have a hard time finding it. It's not that I'm always happy all the time, but I know that joy is different than happiness. Joy is something that can be experienced in the middle of difficulty. And life is complicated, and it's much easier to enjoy life when we're being honest about it and getting the help we need.
Yeah, I think it's so interesting how they're like, oh, if you take that medication, it means like your faith. But we don't tell diabetics not to take their insulin. Like, we don't tell people, oh, if you have hypertension, don't take your hypertension medication. So why are we?
Because I think people think it's something people can control.
Yeah.
I think culturally, I think we think it's more of a treat the symptom than treat the problem. Like a lot of times, even with diabetes, people say, well, how are you eating? What is your eating lifestyle? So a lot of times we feel like culturally it's based on strength-based practices where we're not strong enough so that it shows out that we're weakness. So we don't want to show our weakness. Like, okay, if I just deal with this, if I handle this, I don't need the medication. Like even when I'm sick as a dog, which I don't like taking medication. Even if I'm sick as a dog, I try to eat, drink some ginger or drink some tea for 5 days and realize I'm still sick. So maybe by the 7th day when I'm really sick, I'll take some medication. But by then, I could have been going about my business, going about my day by 5 days ago versus 7 days later.
Yeah.
So a lot of times it's culturally where we think that just shows weakness. if we need medication. But at the same time, that medication, if used properly, can really alleviate some of the burden that whatever our problems are.
Yeah,
and don't you think I'm just like, I am not a professional, by the way, so don't listen to anything I say. I'm only an expert in my own crisis. So that's what I have to say. So as I asked the professional, wouldn't you say that, a lot of people nowadays look also at medication as kind of a crutch, kind of as you were saying, like it's this kind of cop-out? And sometimes it can be, right, if you don't do the other stuff. Like if you don't try to figure out what behaviors are messing you up and like deal with the root issue, as opposed to just dealing. I mean, it's the symptom. Yeah. It's like a combination, right?
I think definitely, because I think one thing that I take issue with a lot of times is that people go to their general practitioners to get treatment.
Ugh, we had this conversation. Let me tell. I won't tell you who my general practitioner is, but he gave me something to take the edge off before I went to a real psychiatrist, and I called my dear friend. This is why you have friends who are doctors. And I said, should I take this? And she said, no.
I was like, what?
You need to get yourself.
I am not a psychiatrist, so my expertise of medication is somewhat limited, but I have a fairly good understanding of it, right? So my issue is that people go to their general practitioners because they feel comfortable. Mm-hmm. And they feel comfortable going to their general practitioner. They feel comfortable saying, oh, it's a physical issue. Right? Mm-hmm. I think a lot of people are okay with it, with sort of like the brain chemistry bit that I just explained to you. They might not outwardly let other people know because it might be them showing a sign of weakness to other people, but they're a little bit more comfortable with it. Oh, it's just kind of like genetically, this is what's happening. So they'll go to their general practitioners, and general practitioners, how long do they spend with you? Like, you spend more time in the waiting room than you do where they're actually attending to you and figuring it out. Like, I remember going to, I get vitamin D deficient at times. And I remember going and the guy giving me it was like a depression measure to see if I was depressed. Which I thought it was just very, really studious of him, but I was also like, I'm not depressed. That vitamin D deficiency can make you very fatigued, very like I'm not doing anything. So it can mirror like one or two symptoms of depression, but it's not. But I always wondered like what his next steps would have been if I had just like filled the questionnaire out a little differently. But a lot of people are comfortable going to their general practitioners, which usually is a good short-term solution, right? Because your body is physically depressed. If you can get, the medication for the depression or anxiety, and sometimes in certain cases people do this with ADHD, which is an issue with people sort of getting over diagnosed with ADHD, because medical doctors, from my understanding, are not trained to do assessment for ADHD. That's a very intense process that psychologists do, right? And so people go and they get these medications, and it takes a while to get your dosage right, first of all. And then the medication isn't addressing the issue, right? So if the medication isn't addressing the issue and there's an underlying issue, you're going to keep medicating yourself. You might as well be using illicit drugs. Mm-hmm. What do you think, friend?
It's taking me in a whole other place. About,
General practitioners. My friend has a story.
I mean, I have a great relationship with my general practitioner, and so I think it's important to have a good relationship, and at least if you're at least talk to someone. And so I do think that knowing though the difference of, you don't go to a hand surgeon if you need surgery on your foot, right? I mean, so thinking about once you go there, maybe that's the first step if you feel comfortable with that, but then
it shouldn't be the ultimate step.
Like,
exactly. It should be something else.
And
and I think to just being holistic in your approach towards this, like Anne was mentioning with the diabetes, right? Like, yes, you can have to take your insulin or with your hypertension, but you can also make some adjustments with your diet and exercise as well, and sort of like the lifestyle that you're living. That doesn't necessarily mean, like I have a really good friend who she's been on hypertension medication since she was like in her 20s, and she's lost a lot of weight, and she's very active, and she eats really well. She still has to be on that medication. It's probably a lower dosage, but she still has to be on it because that's just the makeup of it. And so it's the same thing with this, where like if you're, you know, paying attention to your mental health, you're addressing the issues in your life, you're sort of rooting up that stuff. Because if you never get to the root of something, it's always going to grow back, right? Because the roots are there, right? And so, thanks, friend. And so, until you root stuff up, you're not taking care of it. You're not.
Yeah, I think that that's important too, because I struggle with sleep, and I have because of medical reasons for a long time. But then because I struggled with sleep so much for physical reasons when I was going through treatment for cancer, it affected the way I thought about sleep. So then it became this thing where I was really stressed about sleep because I was always tired. And so now it was a combination of physical and mental. And a lot of doctors just wanted to continue to medicate me, and on medications that you shouldn't really take long term. And so it wasn't until a few years ago that I reached out to a woman who does cognitive behavioral therapy for sleep. And I thought, this is crazy. Like, I'm going to be honest with you. I thought, Nora's not supposed to use the crazy word, but I really thought, this is
I got
weird.
excited about it.
You did. And it was really overwhelming for me, I'm going to be honest with you. And at some point, I ghosted the therapist. I'm sorry. I feel really badly that I did it, but I did it. It was just really stressful for me. It was really overwhelming.
Dear John letter.
Right? She didn't name it. She just ghosted.
I just ghosted her. But I hope she doesn't know it, so she's not watching. But I will say I learned a lot during that process, and it was actually the first step in me starting to really address some of my own mental health issues. And one of the things she taught me was this idea of having constructed worry time. And it was really kind of life-changing for me, this idea of before I go to bed at night, setting aside some time, not right before bed, where I kind of am really thoughtful, maybe it's just 10 minutes, where I'm allowed to worry. Like, I'm allowed to say, these are the things that are stressing me out, these are the things I'm thinking about, writing them down. And then when I wake up in the middle of the night, I do a little self-talk, and I say, you've already thought about that. There's nothing you're going to do right now about this. You can think about it in the morning. Mm-hmm. And it seemed like, when she first told me to do it, it kind of seemed silly, but it actually works for me.
Yeah. I think sometimes you have to give things a try.
Yeah.
Even if it does sound crazy. So cognitive behavioral therapy, so there are different perspectives on therapy and on psychological disorders. So the cognitive perspective says that our thoughts drive our behavior, and our thoughts drive our emotions. The behavioral perspective of psychology says that we learn how to behave. We learn sometimes maladaptive behaviors. We learn everything in life. So if you're engaging in something and it's not very productive, it's not very useful, like you might learn how to worry. You might learn how to be healthy. You might learn how to be unhealthy. So the whole idea behind cognitive behavioral therapy is that you can't necessarily separate or sometimes see which direction, what's affecting what in terms of the cognitions and the behavior. So like your thoughts can drive your behavior, and then your behavior can drive your thoughts, and then your emotions are in the middle with all of that. And so you can think of these arrows going in all these different directions.
No wonder I'm a mess.
Right? Yes, I'm taking questions. Travel becomes me. Send me a question. And so we talk about the whole idea, and with the blog post that I did this week, of taking control of your thoughts. And if you go back to one that I did a couple months ago about irrational thinking.
It's my favorite. It's my favorite. Do it. Do it. Let's all do it together. My favorite.
So we were having a conversation one day, and she says, "What did you say to me?"
I think I was being irrational.
She was. She goes, "I don't want to do stuff, and then it's gonna come across as if it's halfway." And I'm like, "Have you met you? You don't do anything half." I was like, "Vanessa, that is irrational. Throw it away." And she was like, "Oh my God."
She was like, let's take that irrational thought and then let's put it in the pile with all of the other irrational thoughts.
Yeah,
let's physically do it. And then she actually made me physically do it.
Put it away, right? Because when we start saying things like, well, this always happens, or this never happens, or this is how this goes, a lot of times, like I've called her at times, and I'll be like, "Friend, I'm thinking irrationally." And I know it's not. And that's usually when you're in your feelings about something. I was like, I know that what I'm thinking is not the truth.
And I'll confirm it.
But I'm believing it, and it's making me feel some type of way. Right?
It's like when everyone always says follow your heart, and I don't want to get into some like philosophical conversation.
Nope.
No, I'm like, people, if I followed my heart and my feelings, woo, man,
Listen,
it'd be a hot mess all the time.
It would be crazy, right? Yes. How do you support loved ones? We definitely are going to answer that question. So what cognitive behavioral therapy does is it allows you to target those thoughts that are irrational and replace them with rational thoughts. And then you make sure that your actions follow that, right? That's sort of like a simplified version of it. It can be a bit more involved than that. I don't know if anybody else wanted to chime in.
I'm just thinking the whole conversation really at the end of the day is some way to be intentional about mental health. Like really putting it as an item of that we need to take care of besides physical health and everything else. A priority besides all of the stuff that we put for ourselves. And then being responsible, like it's our responsibility at the end of the day. So I think even with the doctors, you could find someone who's really good, that's really good. But even with some other stuff, you may not find the best person. So it's always good for us to be informed about our own mental health, to be able to know what's going to be best at the end of the day. But it's not always easy. But it's just like, I feel like if we bring it, the more we bring it on the table, the more we could address it.
Yeah. Definitely, just get comfortable having a conversation. So someone asked, and I know a lot of people ask this question, like, how do you support a loved one? So I think, Keita, you were asking if they're not ready to accept that they may have an issue. That is hard. I know my answer. What do you say? The person is not ready to admit they have an issue.
You have to take care of, for me, in some ways, if it's something that's really, you can be there with the person, you just have to be careful not to go there with the person in that aspect. I feel like that's when boundaries are important, and you have to know where you can go with this. If the person's not ready, then you have to know where you stand with that. That's kind of like my personal thing, because I'm not going there with anyone.
Yeah, I think because a lot of people, I've had people come to me, like I think one time I was doing something at church and someone was like, I need you to help my brother, like you really need to talk to him, he's going to talk to you. And I'm like, does your brother want to talk to somebody? Because the fact of the matter is, until and unless someone is willing to make that change in their life, you as an individual, you can't do anything about it. Right? So you can maybe gently bring up the topic, like, hey, I've noticed this. What do you think? And kind of see how they react. And then if they're open, then you can discuss it with them. But know that they have to be ready for it, right? So how do you not get discouraged from getting therapy when you can't find a good therapist? Okay, so definitely in terms of helping someone else, just let them know, like, when you're ready, I'm here to support you, or maybe you've gathered the resources for them already, and let them know when you're ready, I have it here. But know that you can't take that responsibility on yourself. And know that if you are taking care of, meaning that you're giving some sort of care or affection to someone who's suffering from a mental illness, you need to also be making sure that you're taking care of yourself.
It's very draining.
Yeah.
Yeah, I will say, like, for myself, for someone who's struggled with mental health issues, and I'm married, my husband, Mr. Walker is what I call him, because that's what his mother calls him.
He's awesome.
He knew long before I knew that I needed to address some of my issues with anxiety more directly. But I had a lot of other issues too, and I was sick of going to doctors. And I will say that he was really skilled at continuing to acknowledge it and encourage me without pushing me. Mm-hmm. So he would say, have you thought about, talking to someone about this, or, oh, I think that's a good idea. Or if I did make a good step, he wouldn't be patronizing, but he would say, like, oh, I'm really proud of you for doing that. He would also, I call it kind of forceful encouragement, where he would, especially when I would go into a depressive kind of state, he would give me moments where I was allowed to do that, and like he would acknowledge, listen, you need this, and then he would say, okay, listen, you've got to do something now. You're going to get up, you're going to shower, you're going to do something. And there was this kind of girding or support where I knew even if I had a bad day, he was still there, and he was there to support me too. But also he wasn't afraid to offend me. And sometimes he had to tell me the truth in love, and that was hard. And I think that sometimes that is a difficult thing when you're living with someone who is struggling and they don't necessarily want to jump in to helping themselves yet. Sometimes it can get a little sticky, and you kind of have to be okay with that uncomfortableness. Yeah.
Mm-hmm. That's good. That's good. I think in terms of finding a good therapist,
it's like dating.
It's like dating. You just kind of got to keep going. No.
Ghost them when you have to.
Ghost them when you have to.
Ghost.
No, we are
she
not.
Was a good therapist.
We are not.
It was me.
No.
It was not her.
No, we are not encouraging ghosting of any
Do
kind.
not follow my lead on this.
Anybody in life.
I remember being totally transparent with you. I was like, I just want you to know I ghosted my therapist.
You can't be ghosting people. That's
I
not
break up
right.
with doctors. I don't break up with, you just gotta break
Okay, so what I would say is if you are in the market for a therapist, think about the things that would be important to you. Ask people that you know if they have any referrals. Look up, there's so much information on the internet now in terms of
Psychology Today. I love it.
Sound like dating to me.
Oh, yeah. And so you can always, my nephew's in there just popping and saying all kinds of things. So you can, hi nephew, I love you. You can also kind of just set up a consultation or try to talk to somebody by phone before you even set up an intake appointment, and see if they would be willing to do that with you. Someone asked a question about how important is it to have a Christian counselor. I don't think it's important.
I mean, this is what I would say. For me, I have had a handful of therapists, and none of them were Christians. That being said, all of the therapists that I went to understood and respected the fact that I was a person of faith. And one of the things that I do, when I was actually just looking for a new therapist recently, I did exactly what you said. I actually came to Keisha and I said, I'm looking for a new therapist who has some suggestions. I talked to my psychiatrist. I talked to some other people. And I had a call with someone. And I was very honest. I said, these are some of the things that I struggle with. I am adopted. I struggle with these things. I have issues with fertility, and that's really become a thing for me. And I'm a person of faith. And having someone who understands that, respects that, and will incorporate that into this, that's important to me. If you do not think that you can do that, then that's fine. And I think that if you approach it that way, and for me, if you are a Christian, I think that as anything, any advice anyone ever gives me, whether it's a doctor or a pastor or a therapist, I always filter everything through my faith. Mm-hmm. And I also get good counsel in the church. So it's not like I do either or. I think it's an and thing. I supplement what I'm getting for my mental health from a doctor, also with getting good counsel from spiritual advisors.
Yeah, I don't say it's terribly important. I think what's really important is that you have someone who's able to understand you and your belief system, and not necessarily share it. I think that I've been in situations where people have come in asking for a Christian counselor, and like because people know that I'm a Christian, I'm not a Christian counselor. That's the thing. Mm-hmm. Like if you want Christian counseling, that's different from counseling, right?
It's different from therapy.
It's different from therapy, right?
Yeah.
So if you want a Christian counseling, to me, a Christian counselor counsels you on how to be a Christian, right? and some of the things that you might be struggling with. But I feel like a therapist or just a counselor in general is going to help you figure out different things in life that I feel like unless that Christian counselor has a background in psychology and psychopathology, they're not going to be able to get at those things for you.
And I feel the approach I would take with this is that if you're someone who's Christian and you want a therapist and your question is, if because I'm a Christian I need a therapist who's Christian, then if you generally inquiring, I would say no, you can have any sort of therapist. But if you're somebody you're Christian and you recognize that you would really need somebody who's Christian to be a therapist, then that's what you should go for. Mm-hmm. But if it's a general question as if is it best for Christians to have a Christian therapist? I would say it's really by preference, but it's not a general rule.
Yeah, I don't think it's a requirement. I don't think it's a requirement.
Because you might force that, and it's basically may not be the best.
Because the therapeutic relationship is an interesting thing. Yeah. Somebody just asked a question about if you're dating, does your partner need to go with you to therapy? The therapeutic, we'll get to that, but the therapeutic relationship is interesting.
Mr. Walker?
Because sometimes, like I know there have been times when I've had male clients and it was important that they have a female clinician therapist because there was some stuff that they needed to work through with women. Mm-hmm. And sometimes, depending on the type of therapy and the dynamic and what's going on, your therapist can be the proxy for that person that you're having an issue with. It just kind of happens naturally sometimes.
You see them through their own BS.
Well, you're assuming that they have BS, and don't be so cynical of the men. They have.
But I also think that might have to do with gender norms in terms of like masculinity and.
But not just that. I think
of talking to a man about your problems.
Yeah. Because I think like I remember a student of mine just being really angry in the classroom. He was just very antagonistic towards me, and he was like, "You must like Oprah. You look like somebody who likes Oprah." And I was like, "What? Like, what is what are you talking about?" But it was very clear that I reminded him of someone, and we had to figure out a way to get along in that classroom. And I think that happens sometimes in therapy too. Mm-hmm. So sometimes having someone who is not quite a man like you or a woman like you or whatever can help you sort of work through that stuff. So now to the dating question. Mm-hmm. If you're dating somebody, I guess this will be the dating segment. We should have some music here. Okay. I don't know what that was. So, if you're dating someone, should they go to therapy with you?
No. I'm like, no, I'm feeling like, why? Like, what's the thing behind the question? Because it's all, they may not need, you could drop
maybe therapy, if they came to therapy, they would have a better understanding of you, of what you're going through.
Is it counselor therapy or is it one session with your boyfriend? Girlfriend?
I don't know.
Because it becomes something else, because I feel like, I don't know is the question, are people who are dating should be going to counseling together?
Who asked the question? Can you clarify?
It was a longer.
Can you clarify your question?
Yeah.
But I know why I would say no as a clinician. But go
You
ahead.
would say no.
I would say no. I wouldn't say no, but I would try to discourage. I would try to gently. We will explore it, and then I would try to gently discourage you from doing it. And I know why. But go ahead.
I mean, I know that. I think that perhaps if you have a really good relationship with your therapist and you're going through something with your partner, and your partner and you are having an issue where you can't talk about something and you need someone to help like mediate that conversation, then I think that would be a valuable thing to use someone who understands you and that you trust to be there and help mediate that conversation. But for me, for someone who's just been in therapy, for myself, it's like, that's my time.
Right.
Like, that's my time. Now, if you need to go to therapy together, then that's fine. Like, I think that there's value in counseling and therapy and talking things out with your partner. But if you just, that's my time.
Yeah.
That's all. That's me.
Really,
I would explore it, and then I also would discourage it. Simply because of this. When you are my client, we have established a relationship. And it's we have our rapport and everything else like that. When you introduce another person into the room, that dynamic may shift. So the way that you are with me may not be the way that you are with your partner. Right? And then all of that is going to come into play. And then if, let's say, your partner says something and I agree with them, then does it mean that I've sided with your partner? And then what does that mean for me and you? And even if it is that there's a difficult conversation that you want to have with your partner, I would encourage you, like, let's practice it. Let me equip you to go have that conversation without bringing that person into this dynamic.
And I have like 2 points about that. So the first point is, I think in some ways, when you also have the person coming in, you really have to explore for yourself, why do you want this person to come in? Because I've had people wanting to bring their significant other for me to tell them what they're supposed to be doing, and that's not quite the right way. Even Michelle Obama was talking about how she went to counseling therapy, and she was like, fix him. And then that's when she learned the most about herself. So it would be like, what would be the real angle in which it would have to be some place where I felt as a therapist that it was gonna be very, very constructive to you to be able to add that person. Otherwise, I think it would be that. And then the second part of, I'm gonna clear out, because I think we're not talking about couples therapy. We're talking about individual sessions into which somebody would bring their significant other. Because then we're not saying couples therapy is not good. We're just saying what would be the reason for bringing your partner
into your individual session.
Yeah, because there would be a difference.
So we do. I recommend. I think you recommend as well that couples therapy should be different from individual therapy.
Yeah,
definitely. Yeah. So while we're talking about dating, someone asked, and I really don't have an answer to this question, but maybe somebody out there does. They wanted to know how they can find a rich man. I don't know.
Rich in love?
I don't know. But there was another dating question, and maybe if somebody out there knows how this person can find a rich man, they can let me know, and I'll let them know.
We'll try it out. We'll test it out first.
You have an answer?
I don't have an answer for this in some ways, but I don't have the answer.
You have a answer. I'll take it because I have nothing.
I don't have the answer.
I have nothing for this person.
I just feel like in some ways, the universe, if you want to call it that, has a way of bringing things that connects with kind of like your vibration. So in some ways, I feel like if you want to attract certain things in your life, then you have to attract. You kind of like to attract.
So I guess let me translate that for the praying people in the audience. You should pray for him.
But also, it's what you put, because if you pour in spirit or if you pour in general, you gotta be who you wanna. You gotta be what you.
So maybe you gotta be what you want. So maybe she should become rich first.
That's the thing. So if you if you're not rich but you want riches, but then I feel like if you want some, you could be somebody who's achieving stuff, somebody who's working on stuff, somebody who's dedicated, and you attract someone who's dedicated, who's achieving and who's working on stuff. I think at the end of the day, there are some qualities that you will want and that you become that we're still in a certain part of our lives where we could still build wealth eventually. So I think if you start attracting these things, it will translate maybe later on into a rich person. Now finding a rich man like tomorrow walking outside, I don't know.
I think also there's a misconception in this country that more means happier, more means more joy, more
That's what
stuff
I say.
means
Oh. So we'll share it and we'll try to get back.
This only has 9 minutes too.
Okay. Sorry guys, I don't know what happened.
Hey,
We're
sorry,
back. I think we
Now we
just
talk to ourselves.
we just went very long, and maybe the internet didn't want us to be talking about rich men.
Oh, there we go.
Maybe the internet didn't want us to be talking about rich men.
Maybe.
You know the
Maybe.
internet.
Maybe.
You know what I'm talking about, right?
They rejected
There is a
your
wrong
vibration.
vibration.
You know the internet.
There's the algorithm.
You know the internet always knows what you're thinking, and then it
Right.
sends you what you're thinking, like all these Facebook ads and stuff. So maybe the internet didn't want us to be
We're
talking
gonna
about
get all
rich
kinds
men.
of Facebook ads.
So we're
later
gonna move
tonight.
on to the next dating question, and then I have 2 career questions that I'm gonna
You was gonna
answer.
say, she was gonna say.
Oh, I'm sorry.
How do you define richness?
How do you
Oh,
define
yes, so I was
richness?
gonna say, I think
you
in
might
this
have a
country-
different definition of
Right.
richness.
And so also
Oh,
this
money.
idea that do we
Greens.
think, what does that look like? And sometimes you get together with someone and they provide you something and you grow together. You never know what someone's actually going to become, right? So I would just caution you that
Yeah.
if that is your top priority, that you get what you pray for sometimes. And let me tell you, if you are sick or lost or lonely, or you're in need of care or compassion or empathy, it's better to have someone that can provide you with those things and stability and can love you in the way that you need to be loved than necessarily buy you some red bottom shoes. That's all I got to say.
Hey, red bottom shoes. Her husband cooks. He's lovely. That is richness.
It is.
Go to that house, he will feed you.
He will.
Okay, so we just got a couple more minutes. So there was another dating question about how to keep from jumping to negative conclusions when dating someone new.
Ooh.
Probably a therapist.
Yeah,
Yeah, I think
that was my short answer too. I
What?
think
Seeking therapy.
seeking therapy. I think because if you are in a new situation and you're jumping to conclusions based on your old situation, then that means that there's some unresolved issues in that old situation, right? So really at the root, again, it goes back to you gotta uproot stuff because it's gonna keep growing back, right? If there are insecurities in you, insecurities that were created from past relationships, insecurities that were caused by past hurts or your life circumstances, you need to address those insecurities because they're going to show up everywhere, including in this new relationship. And it's not fair to let someone pay for another person's sins, right? It's
Yes.
just not fair at all.
Plus, you're not gonna get to a better relationship. I
Yeah,
think
you're
is
not going to
what
have
it
a
is.
good relationship if you're constantly, so you
So
really...
it's not fair to yourself.
It's not fair.
It's
Yeah,
not fair to
also,
yourself as well.
exactly,
You're
yeah.
selling yourself short
Yeah.
by continuing to engage in the same behavior over and over again. And so if you're finding it hard to trust people, the common denominator here is you. Right? And
That is a hard thing to internalize sometimes.
Yeah, I'm sorry.
No, I feel like, and I think specifically when it comes to this, because I feel like I ended up going to therapy because I felt like I kept on dating the same person or kind of getting in the same patterns, and that really helped. I felt like the things the therapist was telling me for I went for a year, from maybe within the first few conversations, and I fought it, and towards the end, towards that year, I was like, okay, that's what I accepted to work on. So it was really something that was important because I think, it was so simple. It was so simple, but it came from not trauma, but more childhood patterns, how I learned to communicate in my family, It was that simple. And so, but it took me a whole year to work through it, and I think it was worth it because then at some point I feel like I'm in a much better place, and it helps. Like, so I think the therapy is definitely
therapy is going to be the answer.
Really helpful.
Yeah. And so someone was asking something about men's behaviors and how men's behaviors can inspire depression in women.
Which ones?
I just, let's not do this to the guys. Let's not. I tried to get a man here today. It didn't work out. If you know a man that could engage in this conversation, please hit me up and let me know who he is, because we would love to include him in this conversation in the future. But you got to be responsible for yourself.
Yeah.
And you teach people how to treat you. And so when you accept certain behaviors, that's what happens there. But let me just get to this. It's basically the same question. You've lost motivation or you've lost passion for your job. Kiva, you know everybody. She's like, I might know one. I knew I should have asked you the other night. You've lost motivation or you've lost your passion for your job. What do you do?
Man, well, I think for me, whenever I've lost motivation about anything, whether it's your job, whether it's your relationship, whether it's your husband, whatever, your partner, is for me, and this might seem like a little cliche right now because everyone likes to talk about gratitude, but I take a moment and I remind myself of all of the things that I have to be thankful for. And I often remind myself, like, sometimes the things that are most dissatisfying to us are the things that we really desired at one point. And the fact that we have those things, we've become kind of, oh, we've got this now, And a lot of times we're so focused on what's next that we forget what's right in front of us. We forget that today is the day. Like I always say, every moment is a destination because we're not promised tomorrow, and that doesn't mean you can't allow that to spur you on to do something else. I had a great coach who once told me, like let your fear, give fear another job in your life. And I said, well, I'm going to let my fear of not doing what I feel like I'm called to do to push me forward to do what I'm going to do. But for me, gratitude is a big thing.
I feel like I've had different approaches to this. I felt like when I didn't feel, I felt like, oh God, I can't with this job anymore. But you can't quit like that because you didn't find a rich man yet. But what happened is I think that I tried to renew myself and renew my spirit about it. Like, so basically, probably through gratitude, but I'm just not so intentional about gratitude. But in some ways, I think it's kind of like something like that. But really try to renew my spirit. And I just changed jobs, and I spent about 6 years something in a job that I thought I was going to stay in 1 year. But I kept on renewing myself. But then when it wasn't, I'm like, well, I'm going to keep on renewing myself because then I got good at renewing myself. Every 6 months, I would just get down and just let everything slack and then get myself, and then I'm all motivated. And then, but then I realized that I read a quote that really is doing it for me. It says that change brings insight far much often than insight will bring change. So sometimes if you're waiting for the idea or the motivation or the insight to bring the change, you might wait for a while. But if you change, then you have new insight that then pushes you to go other places. So it's almost like you really want to move. You want to do something else. I don't know what change is going to mean, but that's kind of like where I go now, whereas, all right, this isn't working. Recently I had to give up a gym I love, but I wasn't going. So I'm like, maybe I need to change gym. Huh?
How could you possibly love it if you didn't go?
I loved it in the past. It doesn't work anymore, but I didn't want to change it. But then I wasn't going, and I wasn't motivated. So I'm like, I need to go back to the gym, but this is not working out. So I'm like, I'm going to cancel. It was hard. I'm going to cancel my membership, and then all of a sudden, you're going to find other stuff. So I found a gym by my house, and I went this morning. I might go tomorrow morning because it's downstairs in some ways. So you kind of that's an example, but I think change really just making a change will change your insight on things and then maybe feed more, bigger.
Answering directly to the question about if you're just, what was it, just...
Like you've lost your passion or your motivation for your job.
I know when I worked at Chase, it's a different job, a million jobs at Chase. So basically, you go have lunch with different people who do different jobs and see what piques your interest about their jobs, or what insightful thing they can tell you about different jobs. But if you're not passionate about your job, there's something that you need to change. Yeah. So you can't just stay there and stay the same forever. You're going to have to look into what can bring you joy, and joy can also bring wealth as well.
Yes.
So,
yes, definitely.
We don't need a rich man.
You don't need the rich man.
No, you don't need a rich man. You can be your own rich man.
The story is you can be your own rich
Isn't
man.
that what Beyonce said?
I don't know. I don't know.
She could say that.
She could say that.
Yeah.
So I think that I 100% agree with everything that the ladies have said here. I think that definitely sometimes we wait for motivation or the right time to do something. Do it anyway, and then see what happens. Because once you do it, you'll feel better, and once you feel better, it'll push you to do a little bit more. So I say go ahead and do it anyway. I think Cynthia had some great advice here where she said, find out what it is about your job that you don't like, and then see if you can address that. Right? So does it mean that you need to maybe get fulfillment from outside of your job? Right, in a hobby or something that you're doing on the side. Or maybe it is that you need to do your job, but in a different setting. Like you can be an accountant, but an accountant that works in a nonprofit is very different from an accountant that works for the big five financial firms. Right? So yeah, and you might need to change your environment and know that you can do whatever it is that you're doing in any number of different environments. Guys, this was an amazing conversation.
And I wanted to say one quickly. So, not too long ago, I was at this talk by Oprah, and she was
fancy.
Right. But she told the story about her niece who was at this job and was feeling really dissatisfied. And her niece came to her and asked her, what should I do? I really don't want to be at this job anymore. I'm really dissatisfied. But her niece could not leave the job because sometimes you can't leave your job, right?
Yeah,
sometimes you can't leave your job. And Oprah said that she said to her, you know what? I want you to get up every day and I want you to say before you go to work, how can I surprise and delight everyone that I come in contact with today? And I thought about that and I was like, well, it seems kind of like, okay, I'm going to surprise and delight. But it was this idea of service, right? So often we talk so much in this world, whether it's in social media and otherwise, about how we can fill ourselves up, how we can take care of ourselves, what we're doing for us. And I'm all about self-care. But what's the goal of that? The goal is to fill ourselves up so that we can fill other people up. The goal is to fill ourselves up so that we can give back to other people. And so just that change of perspective can, I think, help motivate you in the day-to-day until you get to that next thing, while you're having lunch with the people to figure out what your next thing is. But it can help change your perspective about what you're doing today.
Yeah, I think like I always say, just be intentional about everything that you do. It might not be the thing that leads you to your ultimate goal, but every little step counts towards it, right? So this was an amazing conversation. I enjoyed this a lot. I have really great conversations, as you can see, with these ladies all the time. So I will try to invite you to join our conversations. Check out the blog. Do me a favor, forward the blog post to someone. They're really short, and I do that intentionally so people aren't spending a lot of time. Okay, so thank you, Vanessa. Thank you, Alika, and thank you, Ann. My nephew said Ann looked tired. Everybody came from work today.
Yes, sir. Thank you.
Did he say we look tired?
No, he said Ann did. He's just been in here saying all kinds of things. He wants to be included. I'll find something to do with the guys one day. Just wasn't today. And we have someone else here. So we have someone else here that's helping us out. So let me turn around real quick.
Oh, God.
So say, hey,
Hey, guys.
Thank you, Dasha. She's always helping us out. She's amazing. Check out her single, Lady Dossie. Follow her. She sings really beautifully, too. Okay, it was awesome. Y'all have an amazing Thursday night into Friday. I hope you enjoy your weekend. I hope you find some joy. And as always, be intentional. Bye.